Hello, everyone, and thank you for joining us for the 20-minute Return to Work Master Class in Keeping Facilities Healthy and Safe. My name is Tori, and I'll be facilitating today's webinar. After the presentation, we'll open up the floor to questions, so please use the Q&A box on the bottom right-hand corner of your screen to send in your questions. Just be sure to send them to me or the host so we won't miss it. We're recording this session, and it will be sent out along with our Healthy Workplace Communication Kit within the next couple of days. I'd now like to introduce our presenter for today's session, Randy May from Project Clean, facility maintenance expert with over 20 years experience, and Bruce Ferguson, our cleaning and hygiene expert at Bunzl. Over to you, Randy and Bruce.
Thank you, Tori.
Yeah, thank you very much, Tori, and thank you everyone for being here today. We're going to spend some time talking about infectious diseases and learning how we can keep our facilities clean and healthy. And I think you would all agree that cleaning is really key in performing this. So we're going to start our session talking about, believe it or not, we're going to talk about microbiology. And microbiology is important, a part of this, because of the term pathogens. And so what are pathogens? Pathogens are, as you can see, bacteria, virus, or other microbes that can cause disease within a facility. And it's the pathogens that we really want to focus on when we're doing our cleaning that we're really concerned about. Now, there's many different types of microorganisms in the world just being discovered by science, and only 3% of these are actually pathogens. So only 3% are germs, only 3% make people get sick. Now, these pathogens, they create some challenges for us in cleaning. And you can see one of the challenges is they can double their numbers or grow to very large colonies very quickly, every 15 minutes or so. Another challenge is they're found everywhere. They're everywhere throughout the facility, and especially where there's organic material present. And a final challenge is, of course, they're microscopic. They're invisible to the human eye, and so we can't see them. And so it really becomes almost like we're cleaning invisible dirt. And this can become very difficult, and we're going to look at some ways we can overcome that challenge. Other issues with pathogens is some of them are very easily spread or transmitted. And there's, as you can see on the slide, there's 5 transmission routes, and a couple of the transmission routes really relate directly to what we do in cleaning, and that's contact and droplet. So contact transmission is something like a handshake, that's direct transmission, or indirect transmission would be something like a doorknob. And then there's droplet. This is obviously when people sneeze or cough into the air. Small droplets are released, gravity filters them down onto surfaces. So droplet can actually become a form of contact transmission as well. And these are 2 things that through proper cleaning, we can greatly reduce. Other issues with pathogens, you can see that they need 4 elements to multiply. So, and that's to multiply, that's not to live. That's to multiply and grow into these large numbers. So if you remove any one of those elements, you will remove the pathogen's ability to multiply. And especially I like to think about moisture, because some of the areas we clean have more moisture content than others, specifically the bathroom, washrooms, and we'll talk about that a bit later. Other challenges for us, another big challenge with pathogens is how long they can live on surfaces. And you can see that some of them, depending on the strain, can live for up to, well, many, many months on surfaces. This becomes extremely challenging. And we want to remember that when we're doing our cleaning, we really need to focus on the details. We really need to make full contact with the surfaces we're cleaning. If we miss areas, we are potentially missing pathogens, leaving them behind for people to become infected. Another thing we need to think about is when we are cleaning, we want to choose the right cleaner or the right disinfectant, because not all disinfectants will kill all pathogens. So what's new with pathogens or coronavirus? Let's take a look. So over our history, we've are constantly having these new, or what they call novel pathogens. Many of them are respiratory. They come up real quick. All of a sudden, they're just in our communities and our society, and they can affect different communities, from the aged to the young. And if you think back across history, we've had, just in a very short period of time, in 2003 we had SARS, in 2009 we had H1N1, and of course in 2019 we have COVID-19, which we're all too aware of. So we want to be prepared with these. As I mentioned, they do come up pretty quick, and so it's a really good idea to have if you're in the cleaning industry, to have a pandemic plan in place. Also to have well-trained staff who will know what to do and when these things do occur, and also to have the right products as well that are going to be able to help maintain the spread of these infectious diseases. So COVID-19, this is one of the newer strains that we know about. It's caused a lot of problems across our society, and again, just kind of almost happened overnight. Now, how long does COVID-19 live on surfaces? Well, up to 3 days, depending on the type of material it's on. I will say that with COVID-19, things seem to be changing. Information seems to be changing a lot, so that could change at some point as well. And how is COVID-19 spread? Well, it's really spread, uses 3 of those transmission routes. One is droplet, another one is contact, and a third one would be airborne. So if you're close to people, just the fact of them breathing or talking loud can spread the disease, and that's why we're so involved with our social distancing to prevent that. Now, I guess the big thing today we're going to talk about is how can we prevent outbreaks in our facilities. And one of the most important things we can do is consider following something called universal precautions. And I don't know if everyone knows what universal precautions is, but they use it in healthcare a lot, and I think we can use it in every building we clean. And universal precautions is just assuming that every person we come in contact with has potentially infectious disease. We can't tell by looking at someone whether they've got COVID. I can't tell by looking at someone whether they've got hepatitis. So we assume people are infected with disease, and therefore we do certain things all the time to prevent the spread of these potential diseases. And in cleaning, some of these precautions can be hand washing, very important, barriers, personal protective equipment, and of course, proper cleaning and disinfecting. This will help prevent the spread of outbreak.
Thank you very much, Randy. Some great information there. Let's build on that a little bit more as well, too, and really build on that invisible soil. I think it's a great way to put it. It's the stuff that we can't see. When we can't see it, we really need to make sure it's critically important that we do have the right tools in place so that we can ensure that we are achieving the outcomes we're trying to achieve, again, because we can't always see what we are actually cleaning and what's actually happening. So one of the first tools that we do have when it comes to cleaning is obviously, and disinfecting is obviously our disinfectants. And we do need to watch today because we are being inundated with info, whether it's from social medias, from the web, from the news, or just the number of emails that you're getting for new products that are coming out. Fortunately for us in Canada, Canada is one of the more stringent countries for what they allow on labels and for what they allow for claims. It's to the bane of some manufacturers out there and get their products approved in Canada, right? But it really helps to protect us to ensure that we're getting quality products. So the first place you really look when you're looking for a disinfectant is to make sure it does have a DIN or a drug identification number. This does say that it is recognized in Canada, right, as a disinfectant. The other piece specifically related to COVID is making sure that it is listed on Health Canada's site on one of their 2 lists, whether it's the emerging pathogens list or it is the main list that is where the presumption is that based on the type of organism it is and based on the disinfectants and the characteristics of various disinfectants that they will be effective right on the COVID virus. So those are 2 places that you can lean on as you investigate different disinfecting technologies that you might be encountering. Also consider the product form and types of surfaces it's going to be used on, especially the product form. So if we're looking at a dilutable solution, for example, it can be a little more economic for us, cost a little bit less, but we do need to make sure that we do have the tools or the method set up and the process is set up to control the dilutions and make sure that the product is being diluted correctly. So important that we obviously know less is not better, but more is also not better. Sometimes a ready-to-use product makes more sense. If we can't put those controls in place, that can make great sense. There are aerosol disinfectants available as well, much lower use for a number of reasons, but aerosol disinfectants are available. There's tablets available as well, again, but that becomes into dilution, making sure the right amount of water, right amount of tablet. And then wipes. Obviously, wipes, pre-moistened wipes are wipes that you can purchase that you moisten yourself with your disinfectants. And it may be a combination of these that you use as well, too. So if we're doing larger surfaces and larger areas of cleaning, We're going to use our ready-to-use or dilutable solution, and then we're going to, focus and use our wipes, when wipes are available today, on things like our contact points and our door handles and our light switches, right? Things of that nature. And importantly as well, we don't need to be selecting disinfectants that are highly corrosive. We don't need to go after real aggressive products here. There's a lot of disinfectants out there that are available that are very safe to use and be very safe for the staff within your environment, whether it's your housekeeping staff that are using the product or patrons and employees that might be coming into contact with it. Next thing we really want to look at is our cleaning cloth, right? Our cleaning cloth is the most common tool that a housekeeper uses today. Supplying them with rags, torn up bed sheets or torn up towels and such, things that are designed to resist absorbing soil and moisture, will not give us that invisible outcome that we're looking for. So it's so important that we look to things like microfibers, very proven technology. We call it technology in a cloth, right? You take a fiber, you split it 100 times thinner than a single strand of human hair, right? Gives you a great amount of surface on a small cloth to create great friction, great capillary action to lift up and, very importantly, hold on to both soils that we can see, but more importantly, even the soils that we can't see. Right, so allows for a much more effective clean when we wipe surfaces. In addition, they do provide the opportunity for varied colors as well, which color coding, when we look at process and procedure, keeping cloths from going from highly contaminated areas like washrooms to other areas in the facility, allowing a way for our staff to identify which cloths are for which area. So red for washrooms, green for everywhere else. Or green for contact points, right? Another great tool. In addition, they're always the same size, so there is that ability to be able to fold them nicely, create nice flat, even surfaces to clean with, and create additional, cleaning sides for us to utilize as we go from one area to another. Keeping in mind that cleaning cloth that gets over soil can become a mode of transmission as well too. Next, we'll look at shoes and the right PPE and really focus. We're going to focus this on gloves, especially because gloves are, a little tougher to come by these days, especially disposable, single-use gloves. But we really need to focus on single-use gloves. Just like our cleaning cloths can become a vehicle of transmission when they get over soiled, right? So do our gloves, right? They're an extension of our hands, right? We wear gloves, right? Cleaners wear gloves to protect themselves from the chemistry and the chemicals that they're using and such, right? But they can also be transmission vehicles. So very importantly that we use single-use gloves. Keeping in mind this term is in clean and soil separation. And this is not just as applicable to gloves, but as we use cloths and go around and clean our facilities, what are we doing with those cloths? Are they coming into contact with anything else that is clean? Are they coming into contact with clean cloths? So thinking of gloves as well too, making sure our gloves are always stored away from contaminants and soiled objects as well. Ensuring they dispense at one time, right, to prevent them from falling all over the place and getting contaminated. Nothing worse than putting on a glove, thinking we're doing good and we've actually made it a dirty glove for some reason. And making sure we provide a number of sizes so that they do fit correctly. Too small a glove, very tough to move your hands around. Too large a glove can be very tough to handle different objects like our cloths and such and hang on to stuff. Those are the tools that we're cleaning with as well. And so importantly, never use gloves. Remember, right, gloves can become a transmission vehicle as well too.
Thanks, Bruce. Some great information there. So Bruce has given us some information on some of the products. And now we're going to talk a little bit about developing protocols. And really what this is all about is just what are we cleaning and then how are we going to clean it. And so if we take a look, this really talks about, are we concerned about germs on these surfaces that we're looking at, or are we just really wanting to remove soil? And that's the first piece. So cleaning. This is done to remove visible soil and debris. We can do this on floors, windows, anywhere that we're not really concerned about germs. And it's also the first step in sanitizing and potentially disinfecting. So cleaning is a really great thing to do, makes the facility look cleaner. It's not really going to kill germs. However, I will say that proper repeated cleaning will remove a lot of germs from surfaces. Now, sometimes we want to elevate that where we're working in more sensitive areas where pathogens are possibly present. So the next step is sanitizing. Now, sanitizing is something we do a lot in the cleaning business. This is where we're spraying and wiping surfaces, and sanitizing is really designed to reduce microbes to safe levels. It's not really designed to kill them all. I think a very common number you'll see on bottles and packaging is 99.9%, but it's just really designed to lower these to safe levels. And we can also sanitize food surface areas, which is great, but remember, with these areas, we need to clean the area first before we sanitize. And finally, disinfecting. Now, this is when maybe we have outbreaks going on, or maybe we're working in healthcare, maybe there's just more urgency in the cleaning. So disinfecting is designed to eliminate specific pathogens totally from surfaces. And again, is done when this needs to be elevated a little bit. For disinfecting to work well, we really want to make sure that we follow the correct dilution rates. And the key thing with disinfecting is dwell time. And depending on the disinfectant, the dwell times will be different, and it can be up to as much as 10 minutes of wet contact time. Other things we want to be thinking about in terms of protocols. What are we going to clean? Well, we've talked about how hands spread most of the germs in the facility. We talked about the invisible dirt, how difficult it is to control. So we can really make that a lot easier on ourselves by focusing on touch points in our building. This is where the transmission is going to take place, and you can see there's a whole bunch of different touch points on the slide. One of the key ones that I'd like to talk about just for a second are restrooms. And washrooms in particular are a big source of touch points. There can be as many as 10 touch points in a washroom. And washrooms are challenging, and I quite often refer to as washrooms as germ central because they have a few other elements that make them that way. We talked about moisture. Well, washrooms, there's lots of moisture in most washrooms. There is organic material definitely in washrooms. And the other big element in a washroom is there's lots of traffic. So you're getting potentially hundreds of people coming into the same space in a day and all touching the same thing. So really important to focus our cleaning efforts on washrooms when we're trying to control the spread of germs.
Central, love it, Randy. Hey, moving on and looking at, okay, so looking at utilizing the products we talked about correctly. The protocols and procedures so important. Anybody who's heard me talk about this before knows it's, I always refer to it as the 80-20 rule. It really is 80% about process and procedure, right? It's only 20% about the products. Remember, if the door handle doesn't get wiped, it doesn't matter what product we're using. So ensuring we understand how to use our products correctly are very important. Another adage to keep in mind is, we can clean without disinfecting, but we can't disinfect without cleaning. So surfaces still need to be cleaned. Infection prevention is about reducing risk. Every step we take reduces risk. So we clean a surface, with a standard cleaner, we reduce risk. Then we go and we disinfect it, we further reduce risk. Reduce risk, right? Speed clean surfaces of visible soil before disinfecting. We use our microfibers for that. We need to allow that proper dwell time that Randy was referring to earlier. Something I missed before as well too in the selection of your disinfectants is understanding dwell times and what the dwell time is. Dwell times for disinfectants can range anywhere from 1 to 10 minutes. So obviously that can take into account in our selection process as well too. Making sure we're following manufacturer recommendations is critical as well too, and definitely following our correct dilution rates. More is not better and less is definitely not better. And again, ensuring our cleaning teams are wearing gloves when handling disinfectants, and I'll just add to that to say ensuring our teams are wearing gloves when they're handling any kind of chemical. Obviously, standard safety procedures. With the amount of cleaning that we're going to be asked to be doing, or that we're going to be trying to do, and the amount of additional cleaning, remember, repetition, the more cleaning we can do, the better off we're going to be, especially focusing on those contact points. So, don't be afraid to look at technologies like electrostatic disinfecting, which provide an opportunity for us to, one, use electrostatics to create a better outcome, because we're going to get better coverage of the surfaces we're trying to disinfect, and we're going to do it much faster while we use less solution. So great technology to look at for being able to increase the frequencies without putting a lot of demands on resources and staffing levels in order to be able to do that in a very easily repeatable process.
Okay, thanks, Bruce. Well, yeah, we're going to talk just for a second here on training, and this is something I know that is near and dear to both myself and Bruce's heart. So quite often we can have all these great products, for controlling the spread of germs, the great chemicals, but we have staff that aren't properly trained. And I do see this, I have to say, I do see this quite often. So it's really key to provide training for your folks. They are without a doubt the most important part of an infection control program. You want them to feel safe when they're doing this, so they feel that they can do the work without possibly being compromised or infected. I've also found that workers who are well trained are much more motivated and therefore do a much better job and are much more able to focus on the details, which becomes really important when we're talking about cleaning for health. So remember, provide your staff with training, your folks with training, and it's an important part, and you'll get a much better result. And to this end, you can have wall charts available. There's all sorts of training material out here. You can see here's a wall chart on donning gloves. We have another one here on removing gloves. And these two slides, by the way, this information will be sent to all of the participants today. So you will be receiving that. You can even get information on wearing a mask. So there's tons of training information out there available. Really utilize it and give your folks the tools they need to do the job properly and safely.
Excellent. Yeah, no question. Training is so important. Process and procedure being the most critical part of the 80% of what we're doing out there. Our staff definitely need to know how to use the tools. They need to know the processes and procedures, right, that we're putting in place in order to be able to operate them effectively and create the outcomes that we're looking for. The other piece of this as well is inspect what you expect, right? Verify and validate. How are we going to do that? Both for our employees who want that level of comfort and many customers or visitors or people that come into our buildings, that level of comfort that we are doing what we say we're doing. Right? So how are we going to do that? How are we going to validate compliance with against the cleaning protocol? Things you need to keep in mind as you're putting these programs in place. When we do this as well, it can help us really to identify additional training requirements where we see that we're not meeting the levels that we need to be meeting as far as the frequency for cleaning that we want to get to in certain areas. So what is that? Is it retraining that is required for staff to help them be more efficient, or do we need to reevaluate our effectiveness of our program? And the amount of staff that we potentially have, or the tools that we're potentially using. And when we do use tools, so like the Wanda Mobile digital cleaning program management app, that's a good customizable app for what we want to use it for. We can report results. It gives us that ability to report results again, whether it's internal or whether it's external. To customers, right? Internal to employees, say, or external to customers, again, giving them that level of comfort that they're going to be looking for and that level of feeling of safety in their environment. Moving to the communication piece as well, too, and continuing on with communication of the importance of the various habits that we've been trying to develop or working to develop over the last 3 months. Remember, we're most at risk when that invisible world, when something is there that we don't know is there. So if we develop these habits and keep these habits in place as we go forward, we're going to protect ourselves not only from COVID, but from all the other different pathogens out there as well too. So, reminding people of hand hygiene. We've been reminded continuously of hand hygiene, yet we know that 95% of people wash their hands incorrectly. The diagram to the right shows the various areas that are missed, and common mistakes: not using soap at all, not washing for long enough, or not using enough soap, or not washing at all, obviously. And following those hand washing best practices, the 20-second rule, using soap and water. Thoroughly scrubbing all the areas and making sure we're scrubbing all the areas. That's why we need that 20 seconds. And remembering that hand sanitizer is there and a great option when hand washing is not available, allows us to increase the amount of hand hygiene events that we are able to accomplish. Keeping in mind, if your hands are visibly soiled, you do need to use soap and water. Visibly soiled hand sanitizer is not effective. And then the general etiquette that we look for as well, too, coughing and sneezing, cover your mouth and nose with a tissue, or cover with your sleeve, throw out the tissues afterwards so you're not throwing them around and other people aren't going to come into contact with them, and make sure you do wash your hands afterwards or sanitize your hands afterwards. The Bunzel Hand Hygiene Program Guide is available for download as well too on the Bunzel Cleaning and Hygiene website. Different communication pieces that we look at as well too, and just a couple of more pieces to go through. I know we're running a little over here. I apologize. Lots of information in a short amount of time. But again, more tools that are available, and you see this as things open up, and I'm sure you've seen this as you've gone out, how quickly we forget. Things open up a little bit, and people are thinking that COVID is gone. COVID is not gone. And some of these habits, we need to be reminding people that they need to keep these habits in place. Social distancing, keep that 6 feet of distance. So important right now to keep things under control going forward, right? And managing this until there is treatments or there's a vaccine or something. This hasn't gone away. And so the tools and signs that are available and will be sent to you, actually, our Healthy Workplace Communications Kit, which will be sent to everybody on this webinar as well, too. Great tools to use. One last little piece just to touch on as well, too. Again, looking at different tools that are potentially available for us to create that comfort level for for the occupants of our buildings that we are doing what we say we're doing, and that there is that level of comfort of feeling safe. Things like the Wand and Next system, right, which, creates two pieces for us. It creates a customer-facing piece, which allows us to tell the customers when we've cleaned certain areas, when they were last cleaned, which does give people a great deal of comfort, knowing that was done, and allows them to interact as well, too. If the area does need some service as well, too, they can interact with the housekeeping staff if something was missed. And then, very importantly, the back end, again, the collection of this data and very robust data that can be collected to allow us to be able to communicate with, communicate back out to, whether it's internal to employees or whether it's external to patrons and customers and such, being able to communicate with them, what we've been doing and the frequencies that have been covered and what the cleaning program does actually look like. And that's about all that Randy and I have. Just want to thank everybody again very much for taking the time today, and turn things over to Tori.
Super, that was great. Thanks so much, Randy and Bruce. We will now open the floor for our Q&A session. Just as a reminder, please use the Q&A box on the bottom right-hand corner of your screen and type in your question. Be sure to send them to myself, Tori, or the host so we don't miss it. And we'll just jump right in here. It was mentioned to have a pandemic plan in place. What resources are there available, or how would you recommend going about creating one in my facility?
I think they're available online. I don't know if, Bruce, do you guys have such a thing available? Yeah,
so my suggestion is, there's definitely templates available, lots of different templates available for creating a pandemic plan. And you definitely can utilize your resources at Bunzo Cleaning and Hygiene, or Bunzo in general, to assist in that as well, too, right? No question. But definitely, doing searching online, it gives you templates to start with for you to build that plan on what that actually looks like. And yes, tools available through us as well, too.
Yes, absolutely. We have an outbreak management guide on our Bunzo website, which outlines how to put a pandemic plan into place in your facility.
Great.
In terms of paper towels in comparison to cloths, is there a preferred method for effectiveness?
Is that tough to clarify that? I'll assume that is in relation to cleaning. In other words, using a cloth compared to a paper towel for cleaning. In my experience, a cloth, depending on what type of a cloth it is, and I guess there's probably a couple of things to look at here. Is this one, paper towels used for cleaning are more disposable, but paper towels themselves are not necessarily, like that you use to dry your hands, are not designed and not effective at picking up and removing and holding onto soil. So they'd be good for depositing disinfectant behind, where utilizing of a cloth, especially, and I always shy away from just saying a cloth. I like to refer and lean more towards microfiber. Using the right cloth will be far more effective than using just a paper towel. I'll expand on that just a touch more. When you look at paper products, you look at wipes that are designed for cleaning, like your wipes that you get in pop-up Lysol bottles or whatever the bottle might be, that you're utilizing, or Oxivy or whichever products you might be using. Those are designed to provide a certain level of cleaning, but again, very much also designed to leave solution behind and leave disinfectant behind.
Yeah, I would agree with Bruce on that. I think where paper towels might be used would be to clean up, large spills of organic material. So like a blood spill or something where you can just dispose of them and don't have to worry about cleaning them. But outside of that, I think microfibers are going to do a better job for you.
Great, thank you. In regards to gloves, why should I choose nitrile over vinyl?
I'll start with the comment of availability. Right today, gloves can be fairly challenging to come by. I think when we moved through the different types of gloves and disposable gloves that we were using, everybody was using latex, but latex allergies are very real. And potentially very lethal to some people, and so we move away from latex, and it was vinyl gloves that we moved into. And vinyl gloves have very different characteristics in the sense they're not quite as stretchy. They fit loose on the hands, maybe not as comfortable, but overall they do have reasonable resistance to the cleaning products that we are using. Almost as good as a nitrile glove. One of the reasons we moved to nitrile is they do have a little better resistance, and have been, there's been studies out there that show that nitrile does, keep the chemistry and keep chemicals away from people's hands. They're a little better at not allowing it to penetrate through. And again, they fit tight. They're a snugger fit. But I think today what's critical is to really look at it is what's available. Because gloves are, as everybody starts to go back to work, as I've always been talking internally in our organization, as people start to go back to work, more and more demand is being put on the products that are already in super high demand, right, because of the pandemic, right? So, anything to add there, Randy?
No, that's great. That's great information, and I would agree that as people are going back, a lot of these things might become, real shortages again.
Yeah.
Super, thank you so much. And just a reminder, as we're going through the questions here, a recording of the presentation as well as the Q&A session will be sent to you following the WebEx. So the next question is, in a high traffic area, how do we ensure proper dwell time or contact time on the surface? For example, door handles and elevator buttons. It seems almost impossible to leave the area wet with disinfectant for dwell time for some of these products.
Yeah, well, I'll answer a little bit on that. It is very challenging, especially if it's a vertical surface, because obviously the chemical is going to run off. So Bruce did mention that there are products that have shorter dwell times. So for those type of areas, that would be a product to look at. You could try to do the cleaning as well, and where possible in off hours where there's not the public. And I will say one other thing which we didn't really touch on in our discussion is the whole concept of agitation. And so, agitating a surface using a microfiber cloth and cleaning it with friction and pressure also really assists in removing a lot of germs or pathogens from the surface being cleaned. So agitation is an important part in that.
Absolutely, and just to add to that, that's the key there is the mechanical process and the removal and using the microfiber is a huge part of it. And then in your selection of your disinfectants is watching that contact time, right, for what that contact time is, and when you can get down to that minute to 2 minute range, leaving surfaces wet for. And it's important to keep in mind it's not that it's not that it's at 1 minute and 59 seconds everything is still alive and all of a sudden at 2 minutes it's dead, right? It's kind of a gradual kill.
Good point. That's a great point, Bruce. Yeah.
And so getting to that 30-second level on some products, which is a sanitizing level as well too, plus that mechanical action, is going to provide some of that risk reduction that we're looking for. Remember, risk reduction, it's managing risk when we're managing infection prevention and control. Right? If I wipe a surface with a cloth and water, I will reduce the risk because I'll remove some soil or some microbes off of there. If I now wipe it with a disinfectant and I wipe it with a microfiber, I further reduce the risk. Frequency of cleaning and that friction, right, along with the chemistry, is so important.
Super, thank you. So our next question is, what is the difference between food, technical, and industrial grade ethanol in regards to sanitizer?
So I'm fine with that if you Randy, or did you want to answer that?
Yeah, please go ahead. Go ahead.
It's different, and I can't get into the chemistry of what the difference is in the alcohol itself, but industrial grade alcohol would be one of your lowest grade alcohols. When you're in the industrial and the technical grade of alcohol, what ends up happening, you now have restrictions on certain categories of individuals that shouldn't be using it. So, for example, pregnant women or women who are breastfeeding and young children. should not use any industrial technical grade. That's why hospitals will not use industrial technical grade sanitizer. The USP grade, so say the food grade, or even above that, say pharmaceutical grade, right? Again, I don't know the chemistry, but you get rid of those restrictions and those potential harmful effects that can happen for pregnant women and for who, the people we just talked about. In addition, with how much we're all washing our hands right now and how many people's hands are maybe dried and a little bit cracked and such as well too, the industrial and technical grades will put recommendations not to utilize on dry or cracked skin, right, as well too, right? So just caution on that. Again, lots of products available out there, but that's a great question, and understanding that I think is extremely important.
Super, thank you. So our next question is, how often should you change your mop head? For example, in a high traffic area with hardwood floor, going from cleaning weekly to daily, or even in between big crowds, how often should you change the mop head with concern of it becoming a host for bacteria and viruses?
Wow, that's Bruce, what do you think? That's a bit of a tough question to answer. It depends on traffic and soil loads and all sorts of different things.
And a couple of points that I would add to that as well. So you're absolutely right. It's definitely to do with soil loads and such. And when you're using a mop, and if you're using a mop in a mop bucket, for example, and the conventional bucket and ringer process, then it's a declining scale of cleanliness, no question, right? Because we start with clean water, clean mop, we dip it in, we clean part of the floor, we put the mop back in. Now our mop is always a little more soiled. So your guideline really has to be around the level of soil that you are cleaning. And my strong recommendation is that you at least on a daily basis, for example, you would be at the end of a day, for example, you would be laundering your mops, right, or cleaning your mops in some fashion that's effective at cleaning your mops as well too. I think that's critically important. And just to keep in mind, one of the things that I'll keep in mind as well too is we're talking about floors here as well too. Keep them clean. You're not going to disinfect the floor. People walk on them all the time. They're not a contact point, right? There's less concern about what we're going to catch from a floor, but just keep them clean. So the cleaner the mop is and the cleaner the solution is, the cleaner our floors will be. Go ahead, Randy. Sorry.
Yeah, I think that it obviously depends on the facility too. If it's healthcare, you'd want to probably launder them daily. One of the things I see a lot are people who don't wash their mops properly, and the other thing they don't do is after they wash them, they don't give them an opportunity to dry out thoroughly. And if the mop doesn't have a chance to dry thoroughly, that again will be a breeding ground for all sorts of microbes. So that's an important piece as well.
Yeah, and depending on the areas that you're doing, look to flat mops. Flat mops with potentially tools that have reservoirs on them. Things that will allow you to always have clean solution and to easily change mops and to easily launder them as well too, right, throughout your facility.
Super, thank you. So how often should an office be disinfected?
How much time do you have? Right. Sorry, I'll start with that, Randy. I'll let you add in a second. You keep in mind it's frequency. When we look at an office, I'm going to narrow down from the office. I'm going to say let's look at contact points within the office. That's really what we're concerned about. Our frequent contact points. And, frequency of that is keep in mind, I wipe that surface, somebody comes up and touches it, and then another person touches it, right? The more people that touch it, so the higher frequency of contact points would mean that a higher frequency of cleaning, right, of those contact points would be recommended as well too. Keeping in mind that, this is in conjunction with good hand hygiene practices, which are so important to be kept up. So, go ahead, Andy.
Yeah, and I'll add to that because years ago, a doctor made a very good point, which I think is, everyone's concerned about contact points, of course, but the point he made was no one ever got an infectious disease from a doorknob because no one's actually, making that kind of contact with a doorknob. You're getting the disease from your hand, not from the surface itself, not from the touch point itself. So good hand hygiene is, goes a long way to preventing that. In terms of how often would I clean it, it would really depend on traffic. If there's lots of traffic, like Bruce said, the more touches, the more germs are going to be put back on those surfaces. So for high traffic areas, you might do it, several times a day just to help reduce the spread. But at the end of the day, it's really all about hand hygiene and people being responsible for their own personal safety.
And you can gauge it around traffic patterns as well too. For example, an office building has, it's 7 to 8 o'clock in the morning, high traffic coming into the building, doors and entrances that aren't touch-free, handles that have been touched, as well as your elevator buttons. And so we do a complete clean and a disinfection step following that period of time in the day, and then lunchtime is another busy time, and so we do one after that time as well too, right? So you could time it based on activity in your building and your environment as well too. That's different things that we can help with at Bunzo Cleaning and Hygiene as well too, as well as Randy, available to definitely work with you to say, okay, so what frequency makes sense, keeping in mind that resources obviously aren't unlimited, but at the same time too is we need to do what we need to do to keep people safe today.
Super, thank you. So this is a two-part question: do you have a sample cleaning and sanitizing protocol for a facility, and are products such as gloves, sanitizer, electrostatic disinfecting, masks available through Bunzo Canada Cleaning and Hygiene?
I will leave that to you, Bruce.
So the answer to the second part of the question is yes. Availability can be on some of those categories. I call them pandemic-related supplies, so your gloves, your sanitizers, your masks, especially N95 masks and such. Availability and even disinfectants and certain types of disinfectants. We are starting to see, I guess you want to say, the flow, no pun intended, of products starting to come in a little more consistently, but there are still gaps in that. And again, as we start to open up, and we're just starting to open up, those demands are going to significantly increase. So yes, they are available, but the availability can be a little bit spotty. And then the first part of the question, which was tools for setting up what was the first part of the question, Tori? It was a tool for?
Do we have a sample of a cleaning and sanitizing protocol for a facility?
Yes, in many different formats. Yeah, most definitely. Yeah, absolutely. Reach out to us.
The next question is, what are your thoughts on ozone cleaning machines?
Ozone. Well, if you breathe in ozone, it's not good for you. I don't know. So I did work with a machine years past, right? That was extremely effective. It was a fairly substantial machine that combined ozone and other chemistry to, I guess you want to say, fog a room. Fog is probably not the right word, but to mist a room entirely. With ozone, you do need to, and depending on, and again, I'm careful because I'm not sure of any ozone technology out there right now, but you do need to be cautious because when you're utilizing ozone for disinfection, areas need to be closed, vents need to be sealed, right? You can't allow that to dissipate through the building or through the environment, right? Because it has potential, risks. I think there's, and again, I don't know the technology specifically that you're referring to, so I'll refer to it. But compared to ozone that I'm familiar with and the technology that I've dealt with in the past, there are much safer methods that can be, as effective, right, or potentially more effective, I think, that are available today. But again, I think it's important to, you can utilize Randy, Project Clean, utilize us to help you with, and this is something we're doing a lot of today, is working with our clients to weed through the amount of stuff that's flooding us for all these great emerging things that are the next silver bullet to help us never get sick again. Right, and so it can help you look at those technologies to understand them and to see how they might fit and how they might fit in your environment for sure.
Super, thanks, Bruce. The next question is, how wet should a surface be to allow appropriate dwell contact time of 5 minutes?
Again, that would be something that you'd have to gauge on the area that you were cleaning, and that would just have to be, depends on how much air volume was moving in the area, how fast things are going to dry, and it might be a little bit different for every type of facility you were cleaning. But so you could, in my mind, you'd have to sort of play with that yourself a little bit, depending on the building you're in. Any thoughts on that other than that, Bruce?
That's exactly it. And, and to keep a surface wet for depending on the surface as well, too, how much it absorbs.
Yeah, that's true.
And what the surface is, no question. And a surface that is going to be wet for 5 minutes and left wet for 5 minutes is going to be it's going to be very visibly wet.
Yeah.
So but again, air movement, all kinds of things do affect that. I can't, it's tough to speak to the volume of solution that you would need, but it is.
Yeah,
it's going to need to be significantly moist, right? And wet.
Yeah, maybe something you put, that would be sort of a trial and error thing in your facility. You'd saturate the surface, say the table, whatever it is. You go back and, check it out in a few minutes and see where you were at. But it's definitely not going to be just damp wiping. 5 minutes is a very long time. So it would, require a fair bit of solution.
Super, thank you. Our next question is, what is the concern with reusable gloves if they are cleaned and disinfected in between use?
It's making sure that they are cleaned and disinfected properly.
Yeah, and it's very difficult to clean a glove on the inside. You got to remember when people are putting their hands in a glove, we're getting sort of these elements that microbes like. It's warm in there, it's moist in there, it's a perfect breeding ground for microbes. And so, the small amount of money that you might save, it's not worth the risk. And again, getting the inside of a glove is difficult to clean, and you'd have to sort of pull them out. And I can't see it being worth the investment.
Remember, infection prevention. Great comments, Randy. Bang on. And infection prevention is about risk reduction. That's an increase in risk, right? And so that turns us the other way, because we put a lot more variables in place on if we're going to be able to be able to do that effectively. Now, that said, you have no gloves available whatsoever, and you need something, and you have a reusable glove available until you can get disposable gloves and single-use gloves, then that might be your only option as well too, because your housekeepers, people that are cleaning, still need to wear gloves, right? They have to wear gloves to protect themselves from the chemicals, right? So that's a last resort.
Yeah, you will eventually start getting, because they're not like a utility glove, you also will eventually begin to get nicks and cuts in the glove as well, which is a problem.
Super. What cleaning processes do you need to have in place if you had a COVID positive case on site?
Great question.
Yeah.
So, you know what? So if you have a COVID situation on site, let's just assume it's say an office, for example, right? I think from a protocol perspective of what we've seen has been developed, right, is that the office is obviously closed, right, and a complete clean needs to be done on the environment. In some cases, the office is left closed for 72 hours or longer, right, with the understanding that COVID on any surface is probably not going to be alive after that 72 hours. Things you're going to need to keep in mind is a complete clean of the environment, touching every potential contact point and surface in the environment is going to be critical. Largely for removal of the organism, but for that level of comfort and safety for people coming back as well too. And then the personal protective equipment that people should wear when they're getting into that environment to clean in that environment as well too.
Access to hand soap and hand sanitizer would be something important as well. And to Bruce's point in terms of the time, so they think about 3 days and COVID dies on surfaces, but it actually begins to degrade out quite rapidly. So even after a day or so, there might be some remaining, but it's become almost inactive. So certainly after 3 days, things would be safe and fine from that perspective.
Yeah. And again, the standard protocol seems to be that places do close, right? They do send employees home until they get the chance to do that complete clean. They may wait the 72 hours, they may not. But a complete clean. And remember, you're looking for a clean and disinfection step in this case, without question. So you clean all your surfaces, but you do a second step, which is disinfect. Remember, I can't disinfect unless I clean. So I'm going to clean, then I'm going to disinfect. And I'm going to go through and do my disinfection step. And that's where you can look at different tools that are available as well, too, like the electrostatics, which are great tools for you go through, you do the clean, and then you do the electrostatic disinfection throughout your environment. Very quick, very effective, very efficient, and extremely effective as well, too.
Awesome. The next question is, what is the recommendation for outdoor play apparatuses and equipment with plastic coatings to ensure that it is safe for children as well as community use?
Ooh, that's a good one.
Yeah, that's an interesting question. I mean, a lot of playgrounds are closed, right? Just because there's not a whole lot that you could do in terms of. I mean, you could clean them, but again, they only really stay as clean and disinfected until the next group of people who start to use them. So that's a bit of a challenge for sure.
Yeah, and it's and as they open up as well too, and the outdoor environment will have some effect as well too. But still, those surfaces can become contaminated. I think it's going to be education around to your kids as much as possible, and however tough. My kids are a lot older now, but I had kids, and getting your kids to keep their hands away from their faces and to sanitize their hands frequently right after they utilize the equipment and stuff, I think is going to be going to be key. And then again, too, I don't know what's being set up, and it's a great question because I'm not 100% sure how this is going to be managed. Something I've thought about when I run by all these parks, these playgrounds that are closed and stuff, and how they're going to manage that from a cleaning perspective. So even electrostatics from that standpoint, where you could utilize that, too much wind, and you're going to have a little bit of issue as well too. But it's I'm assuming it's going to be a process of cleaning, right? Of having to clean them on a frequent basis.
Yeah, and maybe the best thing to do in that environment would just be, as for kids, these are things that kids are on, so the entire playground is one massive touch point, and so you might almost be better off perhaps to go in and clean, with because they are outdoor, like almost like a pressure washer, just hose and some detergent, hose everything down. Might be a more effective way of doing it instead of using sort of traditional indoor methods for cleaning.
Yeah, great question. As I sort of sit here and think through it right now, the equipment's going to need to be cleaned, and then again, very importantly, just educate your kids as much as possible, and keep sanitizer handy as much as possible to utilize as well too. Because again, I love Randy's point before. People don't get sick from a door handle because they don't actually lick the door handle, right? They get sick from their hands and what they picked up off the door handle. They're not going to get sick from the equipment. They're going to get sick from what they pick up off it onto their hands, which makes it to their face.
Yeah, and sort of that point, maybe before kids hit the playground, parents sanitize their hands, and the minute they get off the playground, they sanitize their hands again.
Yeah, right. So, great question though. Gets me thinking.
Yeah, I'm like you, Bruce. My kids are too old.
Yeah.
So the next question is, what is the best recommended brand for disinfectants?
Whatever we sell? No, that's wrong. Wrong answer.
Good answer, Bruce.
What's the best brand? Again, I'm going to lean you towards, this is not about brands. This is not about promoting products, right? So, I'm going to lean you towards is what's best for your environment, right? And again, focus on the surfaces that you're cleaning. Focus on disinfectants that that are not corrosive, right? That have low corrosive or low toxicity. Let's put that. It shouldn't be corrosive, and they have low toxicity. And you really focus on disinfectants too with low contact times. Obviously, because to the question previously about how do I keep that contact time, or how do I keep a surface wet for 5 minutes? Well, if I have availability of a disinfectant that makes sense for my environment with the chemical makeup of the disinfectant, and it's a 2-minute contact time, then that's probably something I may lean towards, right, for that lower contact time as well too, right? So just keep in mind, the selection and the criteria around your selection. There's lots of great manufacturers out there, lots of great products out there. Follow the guidelines. And sorry, just rambling on a bit, but follow the guidelines that we've laid out before and weed through, right? I'll call it the snake oil, right? Make sure it's got the DIN registration. Make sure you have those registrations that you need as well too.
Yeah, and if you are, mixing it yourself, really make sure you follow the dilution rate on whatever product you are using. That's a very important piece with disinfectants, and quite often people don't. So that's a key thing to remember.
Great point.
Awesome. Our next question is, with shortages worldwide on gloves, is there an alternative recommendation as they become less available?
Just if you couldn't get gloves and you still had work to do, I mean, you can, if you were thorough enough and did hand washing often enough, you wouldn't, you could probably do without gloves if there was a shortage. If you have to get things done, hand washing would be a solution to that problem.
And I think
unless you're dealing with chemical, of course, if it's a strong chemical, then that becomes more of a challenge. But if it's just to remove germs, then thorough and aggressive hand washing done often would be a solution.
And you know what? It's great question, because we've seen major shortages, right, of gloves, both reusable and single-use gloves. And I think if you can't find single-use gloves, then again, that last resort is the reusable gloves to utilize those. If you can't find any gloves, I haven't seen it where there's no gloves available, there's no gloves not available at this particular point in time. But it's you don't want to see staff having to clean. And again, it's not the concern is not with housekeepers. It's not about them getting COVID on their hands, right? They're not going to get sick from COVID getting on their hands, right? Gets on their gloves, they touch their face, they're going to make themselves sick as well too, right? So it's about the chemistry and about protecting them from the chemical, right? Health and safety. And so you can't use chemicals without gloves unless you have a product that unless you do select a product that does say that gloves are not necessary, which I'm not. There's not many. There's not many to none out there that recommend that or don't recommend at least gloves with your disinfectants. I will make the recommendation though, if you do come across and you find gloves where gloves are scarce, right, is grab what you can and don't be afraid to try and stock up a little bit on your gloves at this particular point in time as well too. Most companies are allocating like we are. But if you do find an opportunity to get some extra gloves, then it wouldn't hurt to it's all part of your pandemic preparedness as well too. Question about pandemic plan, but building up a little bit of a repertoire or repository of gloves is probably not a bad idea. So, or depository.
Great. So, and also just a reminder, you can talk to us about gloves as well, as they are required for PPE, and we highly recommend wearing them when cleaning. You can run into some safety issues without, so our local cleaning and hygiene experts are happy to help you with all of your glove needs. So our next question is, using wipes like Diversity products, how many times can it be used on different surfaces?
Yeah, I'll let you handle that, Bruce.
Just repeat the question one time there, Tori. Sorry.
So using wipes like a Diversity product, how many times can it be used on a different surface? So how many times would you be able to use one wipe on different surfaces?
As the wipe dries, right, then you're not good. Okay, so two things to keep in mind here is the level of moisture you're going to be able to leave on the surfaces and the amount of surfaces you go from, right? Keeping in mind that as the wipe starts to dry and you start to use up the effectiveness of the disinfectant, now you could just potentially be moving stuff from one area to another. I am not sure if there is a actual recommendation that comes from Diversity on that. So that's something that we will, if you want to follow up with us, we will. And I'm not sure if you can see who's asking the questions there, Tori, but that's something that we can get back to them on if there is a recommendation. But I sit here and think, as I'm going through and I'm cleaning, I'm using one of the wipes. I'm doing the front and I'm doing both sides of a door and the door handle and maybe the light switch, and that's not much further than that.
Okay, great. Thank you. The next question is there information on a disinfectant's effectiveness relative to dwell times? And then they said, I can't see anybody waiting 10 minutes before wiping dry, so any statistical facts to back up the dwell time?
Yeah, most manufacturers, on their disinfectants, they will have dwell times and lots of information that they can provide you in terms of backing up, how long it will take to dry surfaces. And many of them are 10 minutes. I think as technology's improved, they've gotten shorter. But traditionally, 10 minutes was sort of the standard dwell each product will have lots of information, lots of efficacy information on exactly what dwell time is required for, what sort of surface and what sort of pathogen you may be dealing with.
And you know, in Canada, again, you know, thankfully in Canada with our stringent requirements as well too, if you have a DIN registered product, if it's listed and noted on the label, it has been approved by Health Canada to make those claims. So if there's, you know, any organism that they want to specifically make a claim against, right, it has to be listed on the label. In addition to, you know, if they're going to say it's a 2-minute contact time and it's listed on the label, that label has been approved by Health Canada based on the testing, right, that has been done, or if it's 10 minutes or 5 minutes, whatever it is, but that label has been vetted, you know, based on the testing that has been done for that product. It has been approved by Health Canada.
Perfect. Thank you, Bruce. The next question is, what is the difference between alcohol-based hand sanitizers and non-alcohol-based hand sanitizers?
Difference is the active ingredient, right? Active ingredient in alcohol-based hand sanitizers is alcohol, and then, you know, you have different levels of alcohol as well, which we're seeing today, you know, with the challenges in getting them refined in the USP grade alcohol, and then usually it tends to be a quaternary compound in non-alcohol based hand sanitizers, and claims vary across both depending on the concentrations. I think, you know, hospitals and healthcare facilities definitely lean towards alcohol-based products for their proven results and continued outcomes for what they're able to provide, and the level of kill that you get in the breadth of organisms that they're effective on. But I know a lot of facilities do use the non-alcohol-based hand sanitizers as well too. And what I will say, some hand sanitizer is better than no hand sanitizer right now. So.
Super, thank you. So we have time for one more question, and we will get to the rest of the questions if we didn't get to yours today through our communication with all of our materials sent out. And then the last one is, how should clothes be cleaned after cleaning and disinfecting? Is there specific laundry detergents that should be used to rid the clothes of chemicals and disinfectants?
No, I think any laundry detergent would be fine. It's all about, you know, it's all about the chemical agitation. It's all about the agitation in the machine. It's about the chemical, and it's about the rinsing afterwards. And if it was a concern of germs, then obviously drying it is going to help as well. But if it's just getting rid of chemical or material out of the clothes, just I think just your standard, a good quality laundry detergent and agitation and rinsing will be great.
Yeah, absolutely. Yeah. Your standard laundry procedure will be fine. And then to reemphasize the point that Randy made there about drying, you know, if you are concerned about microbes or pathogens, you know, going through and making sure you do dry your clothes as well too. You know, we're not going to say you're disinfecting your clothes, but going through all the steps of the washing process will significantly reduce to eliminate any risk.
Super, thank you so much. So that is all the time for questions we have. Today we wanted to thank you so much for attending our 20-minute masterclass. Our cleaning and hygiene experts will reach out to you with answers to your questions if we weren't able to get to them. And as a reminder, we will be sending out our Healthy Workplace Communication Kit along with a recording of this presentation within the next couple of days. And yes, the communications are available in French as well. Thank you so much for your time today.
Thanks, everyone.
Thanks, folks.